let's talk about the procedure. What's involved, what the recovery is like, what the pain is like.
Yes. A little bit about the procedure. I think that it has evolved over the last 2 years, and that we tend to recommend more full face laser procedures as opposed to regional lasers. For instance, if an individual has deeper wrinkles around the mouth, but maybe less so in the crow's feet and cheek area, and really wants to concentrate there, we certainly can do that. But by doing a full face laser, everything as it heals is easier to hide, the redness in particular. Basically, trying to cover that topic in a nutshell, if we're going to be doing a full face laser, we do it under some form of anesthesia, whether it be heavy sedation, meaning heavy amounts of relaxing medicine in addition to local anesthetics, or under general anesthesia. The laser itself, what it does is removes a controlled amount of skin with each pass of the laser. That's where I think the laser has its great advantage, in that a chemical peel is basically a controlled acid burn, if you will, to the skin. That acid doesn't know if it's dealing with an area with thicker wrinkles or an area that's thicker skinned with old acne scars, or whether it's a very thin-skinned eyelid area. It treats everything the same. Whereas with the laser, you can control how deeply you treat each individual area, as well as the ability to individually treat individual wrinkles, knock off the shoulders of the wrinkles. So it allows us as surgeons much more control to individually customize the area on the face that we're treating. Once we've done that and removed the outer layers of skin, you have a red, raw, treated area. You know, we'll use the full face as an example. It generally takes about 7 to 10 days for that raw facial area to resurface with new skin. That new skin is then pink or red. The amount of pinkness or the amount of redness that you have is determined by several things. Number one, the pre-existing skin color that you have, how much, whether you're very fair-skinned. Fair-skinned individuals tend to remain red longer than darker-skinned individuals, as well as how deeply it was treated. The deeper the wrinkles, the deeper you have to treat something, the longer it takes it to heal, and the longer the redness is going to remain. Certainly, I think the redness after laser is the most common complaint of patients. Once it does fade, patients tend to forget about it pretty quickly because they see the wonderful results that they've had. How long does the redness last? It really varies, again, according to the things I've just mentioned, but anywhere from 1 to 3 months, and can even last upwards of 6 months. So that is of concern, and we have a number of different creams, medications, steroid creams, things like that that can improve upon it, and it can be covered up with foundation or makeup while it's present. You have to be very careful of the sun during that time frame. It's easier to deal with in women than men. Men are going to be much less likely to want to wear that cover-up or foundation. So something we always sit down and talk to the individual about ahead of time.
Right. Now, this makeup that you just mentioned, the foundation, the makeup, would be available even in those early stages of redness to cover that. Am I correct with that?
Yeah. Well, the early, I like to tell people the acute downtime is 7 to 10 days. When you're red and raw and you have some ooziness and things like that, you can't really cover that up. That you're unsightly and you won't want to be at work and you won't want to be out and about. After you've got that raw surface recovered up with new skin growth, after that 7 to 10 day period, then you can start using the makeup. But all the rawness has to be gone. We don't like putting makeup on top of a raw surface.
Right. What about the level of pain that the individual might undergo? Because you're talking about a raw face. That sounds like it would bring with it some degree of discomfort.
Yeah. You know, it's funny. We can do 100 patients, and 10 will complain of moderate to severe burning that generally only lasts a couple of days. And by keeping it very moist with the creams, it tends to keep that discomfort down. We'll do 10 of that 100. 10 had that problem. 10 will never feel any pain whatsoever, and everybody else is in between that spectrum. I think in general there is a little bit of burning that is well controlled with pain medication and with the keeping it moist with the cover, the petroleum type cover up that we have one use after laser.
Would it be less than what you had heard from your patients in the past under the chemical peels, the intense chemical peels?
I think it's basically the same as far as the amount of discomfort. You know, again, it's very difficult ahead of time to predict how much one will have. But I think in general, I think it's safe to say that you look worse in the acute red raw phase than you feel. In other words, your husband or wife would look at you and say, "Gee, that must be very painful," and you say, "No, actually, I feel fine."
Right.
You know.
Right. I think also it's important as people hear about this that they do understand that there is no magic cure that can just sap away the wrinkles and have no downtime, no discomfort or irritation with it at all. That if you are going to undergo these changes, there is what is it, the old saying, you've got to break a few eggs to make an omelet. And that's kind of what we're looking at.
Yeah, I mean, people with new technology and with the laser like to think of, well, gee, you can laser it, it's gone, there's no downtime, etc. But you're exactly right. And again, superficial problems, superficial wrinkles, very faint skin discoloration, mild texture changes are treated very superficially. And the scenario that we've spoken about, the healing time, etc., is for the deeper areas. Certainly we have a mode on the laser that allows us to treat things very superficially that don't require deeper treatment. Those are only raw for several days, and that pinkness is generally gone within 2 to 3 weeks. So again, it's all a matter of degree depending on your problem. The worse the problem, I guess the longer you have to expect to heal from the correction of that problem.
So that sounds like the earlier that you come, when you begin to see these wrinkles occur, the less intensive the procedure and the better your recovery.
Certainly in the 35, 40-year-old versus the 70-year-old that's been smoking for years and years and has very, very deep wrinkles around the mouth.